Hey there, it's Dr. Brian McKay, and I want to talk to you about the Back Pain Project. Now, is back pain exciting? No, clearly not. Uh, it, it, it sucks if you have it, and that's where this conversation could be a good one for you. The Back Pain Project came about because I've been practicing for over 30 years right now. And what I've seen is, treatments come, go. Here's the latest. Here's the greatest. Active release. You've got dynamic stretch, PNF, and what it just seems like there's fad after fad after fad. And basically, back pain comes down to a couple of things. One, it's the standard American diet, which sucks. So people eating and drinking way too much, much more than they should. Second of all, we're sitting down way, way, way too much. I mean, the amount of sitting we do is horrific. I mean, sitting is the new cancer. I'm sure you're hearing this if you're taking the time to listen to this. So the other thing is people aren't exercising enough. People think they are. I mean, I have well-intentioned brothers who tell me that they get their exercise cutting the grass. That's great, but it doesn't really cut it. So what happens here is you've got poor diet, poor lifestyle, not enough exercise. Let's not add in drinking and smoking, which is a whole nother nightmare unto itself. So we have a large swath of the population don't take care of themselves. So basically, if you're not willing to exercise, Back Pain Project is not for you, hands down. Um, if you're tired of living with chronic low back pain, then the Back Pain Project might be for you. But if you're not going to do the home exercises, you're wasting your time and your money because it is not free and the treatment is not cheap. And a lot of times these days, insurance companies don't cover it. You got to think about that. Insurance is getting to the point where it's not this luxury we used to know. It's something for emergencies. You're having a heart attack, go to the hospital. They'll cover most of it, we hope, right? So who's this program for? The program is for someone who really wants to change their life. Are you tired of living with back pain? Well, if you are, then this is a good program for you. And it's a concise program, very concise program. It takes about 8, maybe 10 weeks, depending on how bad it is. But it's really all up to you on how successful the program is going to be. So what I want you to think about here is, I mean, I'm going to throw a few different different therapies because you've been to the chiropractic, great. And listen, I'm a chiropractor, and chiropractic works many times, and it can work very successfully for a lot of people. So don't poo-poo it, and just same thing with physical therapy. But I think if your problem is not getting solved, you already tried chiropractic, PT, massage, maybe you tried rolfing. Well, all these things are good, but sometimes it's just not the right solution to your problem. So let's go over just a few different things that we do. First of all, I've been doing spinal decompression for 20, 22 years. I think I was the fifth person in the country to take delivery on the equipment. And so I've got a lot of experience with spinal decompression. People try it, they don't like it. We're on a third generation, hands down the best unit I've seen. As a matter of fact, I'm in the process of ordering a second one right now because it is that good and because it can change the quality of people's lives. If you're not decompressing the spinal disc, you're going to have lifelong problems. You're never going to get it. You might as well just keep popping Advil and Aleve and kill your liver and kidneys doing that. But we have a thing called the Back on Track, and it does the best spinal decompression on the market. And again, this is a third machine. I'm getting a third generation. I'm already getting a second one. So let that sink in for a second. The other thing we started doing is we started adding pulse radial extracorporeal shock wave to eliminating low back pain. What happens is your blood flow sometimes compromised in the area. If you're sitting on that thing, you're sitting on your butt for 18 hours a day. Yeah, you can have some serious issues there. So we need to address it. And what the radial extracorporeal shock wave it does is it allows for blood flow through angiogenesis. So it's a loud tap. I mean, sometimes people have to wear earplugs when they're in there. But what it does is it creates, it's almost like a bullet within a container. In the end, it hits the plate, which then that shock goes into the system. To give you an idea, this is the same. If you ever had a kidney stone, people have gone to the hospital for kidney stones, and they tap on the outside of the kidney. Similar, it's actually the same company, but this is made for soft tissue. So not only we use it for bad backs, we use it for tennis elbow, head, shoulders, traps, plantar fasciitis, you know, basically anywhere you have a chronic tissue adhesions form, where you want to break up the adhesions and promote angiogenesis, which is increased blood vessels, and that can be done. Angiogenesis doesn't stop as you get older; it can continue to happen. So those are just two things. We got the back on track, the pulse radial shock wave. Now, something we're doing now that's really exciting is called the Live O2 adaptive contrast therapy. And this is to get blood flow. If you're not getting oxygen into the blood, into the red blood cells to the damaged area, it's just going to take a hell of a lot longer for you to heal. That's all there is to it. There is no other way to describe it. So this is something that you're probably not aware of, but I mean, oxygen. Your cells need oxygen. When you get enough oxygen to the cell, what will happen is the cell membrane will become more permeable, and you can actually get some of the toxins out of the cell. So oxygen therapy is really, really important. It's not just stand there with the cannula in your nose as you see somebody in a hospital bed. We try to do is put people onto a program where we're vacillating between low concentration, high concentration. And the low concentration is one where it's like riding a bicycle uphill in Colorado if you're from San Diego, at sea level. So what happens is you place greater demand using a lesser concentration, so it makes you work harder. And then after a period of working harder, we switch you over to concentrated oxygen, which kind of invigorates the red blood cells. So it's pretty powerful. It's a great addition. And this is what separates the back pain project from a number of other ways of treating back pain, especially medications. First of all, there's no medications with the back pain project. If the nerve is really damaged, which it can be, you had a number of surgeries or serious trauma, or just a long term, you ignore the crap out of your back, we're going to send you home with a unit called a rebuilder. The rebuilder allows for like the nerve regeneration through a certain 7.83 megahertz, which kind of caps the nerve pain and then allows it to heal. Pretty interesting. It's working very well. We use it for our peripheral neuropathy cases, and I'm pretty happy with that. Next up, we got the Hako-Med for nerve regeneration, repair nerve damage from chronic back pain. Very, very effective. This treatment comes out of Germany. The Germans are very sticklers, as they are with their cars, for high quality equipment. And this is a real game changer. I might add the machine costs $45,000. So it better work. But I mean, it's one of those things like that can really add to the enhanced healing process. We use cupping. Now, cupping is helpful to relieve tissue congestion. When that lactic acid pools and the dysfunctional. When I say dysfunctional, I mean the DYS functional, not DIS. I'm not dissing you, DYSing you. Well, the dysfunctional tissue, you have tissue congestion, and cupping is something from acupuncture where you create tension that draws out this tissue and the fluids, and it restores it to a normal functioning level. Very effective. Hurts a little bit when you're doing it, but you need to know that before, and we would tell you that, of course, before you came in for treatment. Graston Graston's a fantastic soft tissue technique. So as you see, so far I haven't mentioned one thing about chiropractic. I will, but it's not the whole course of care. And once people find out, oh, he's a chiropractor, I get that all the time. Oh, you're a chiropractor, click. Hey, it's their loss, not mine. Instrument-assisted soft tissue mobilization. Graston. It's 6 of one, half a dozen the other. It's basically a cinnamon. Graston started it. And what it does is it reduces adhesions. Adhesions are basically micro scar tissue. If you want to break up the adhesion, use Graston. It's a stainless steel tool. Very, very effective. Next on our list, Trigenics. Trigenics is a fantastic way to really lock in on the problem by diagnosing either muscle length problems or weakness. Is the muscle short? Is it too long? Is it weak? Usually it's not too strong, but weak would be the primary one. And by identifying that and stimulate what we call the Golgi Tendon Organs, we are able to really get in there and make a difference and restore the connection from the brain, from the damaged part of the muscle or affected part of the muscle through the afferent nerves that go up to the brain and then back with a signal down. matter of fact, there's only really one nerve in the body. It's the muscle spindle cells that really go up to and from the brain. So it's pretty important that that pathway stays open. They also, you need to know, is the stimulates brain. I'm sorry, it inhibits pain. Doesn't stimulate the brain, inhibits pain. So Trigenics is a fantastic game changer as far as I'm concerned when it comes to treating bad backs. Now, here's the next one, chiropractic. Hell yeah, I use chiropractic. Chiropractic has been around. It's been around for 125 years for a reason. As much as many of the MDs poo-poo it, I mean, when I was a kid, my MD told me to become a garbage man before I thought about becoming a chiropractor. Well, I didn't listen. I did listen for many years, and it went sideways, but that's in the past. So that's basically, in a nutshell, what the back pain project is. But when we do several therapies on each visit, you're going to get better a lot faster. And it's not your old therapies, but you got to do the exercises too. If you're not going to do the exercises, it won't even take you. So here's the situation. You want to learn more? Give us a call. Back Pain Project. Just call the office 203-656-3636. 203-656-3636. I'm Dr. Brian McKay. Maybe the Back Pain Project could become your next best friend. Who knows? All right, give us a call. Have a great day. Bye now.